speaker for tonight, Professor Kay Cooper. Kay is a clinical professor of allied health professions, which is a joint appointment between Robert Gordan University and NHS Grampian. She is academic strategic lead for research in the School of Health Sciences at Robert Gordan University and allied health professions research lead in NHS Grampian. Kay is also the director of the Scottish Centre for Evidence-Based Multi-Professional Practice, which is a JBI Centre of Excellence. They focus on conducting and training individuals to conduct systematic reviews. Kay's research focuses on self-management of long-term conditions, development of interventions to facilitate self-management and promote physical and mental well-being, and delivery of health services. Her current research is funded by the National Institute for Health Research and NHS Grampian. Kay is very passionate in supporting practicing allied health professions to get into research. So tonight, let's all welcome Professor Kay Cooper. So I'll hand it over to Kay.
Thanks very much for that introduction, Lucy. And I believe, do we have the poll? I believe we were asking participants to tell us where they were at in their systematic review journey. So it would be kind of asked by just asking everyone to very quickly answer this question, just to get a feel for where people are at. Okay, and I am not seeing any results of the poll, so I am, oh brilliant, the results are here, fab. Okay, so it's just really good to get a feel. So around, yeah, okay, so we've got some folks doing a systematic review, about to do a systematic review, about to undertake, fantastic. So that's a really good range actually. So I hope that wherever you are in your systematic review journey, you will be able to take something away from this presentation. So I am just going to get my slides up on screen. And perhaps if, Lucy, can you give me a thumbs up if you're seeing that? Perfect, okay. We had some slight technical issues when we were preparing. So I'm going to get straight into it. Lucy's given me a really nice introduction and I'm delighted to be here with you this evening, as it is for some of you, but this morning as it is here in sunny Scotland. Delighted to be joining you. So Lucy's already told you where I'm based. I'm a clinical professor of allied health professions and I'm delighted to be also a JBI Centre Director. So what I'm going to talk about is this pre-planning and protocol development. So it is a presentation in two halves. So I'll focus on the pre-planning first and then come into protocol development. Hopefully giving an indication of perhaps some of the pitfalls to avoid and some tips for success. And this is really based on my experience as a systematic reviewer. So I've been involved in systematic reviews and involved with JBI for around the past 10 years or so. I've obviously conducted a number of systematic reviews myself. I've published mainly effectiveness, scoping, umbrella and mixed methods reviews, and supervised numerous students at master's and doctoral level with their systematic reviews. So this is really based on a lot of my own experience, obviously others' experience as well, and some bits and pieces from the literature. I'm a fairly simple person, so my presentation hopefully will be fairly easy to understand. I have the key things that I hope you'll take away from this presentation are generally in bold and bright red text, and even if you just take away these few key messages, then that would be grand. So we all kind of know this about proper prior preparation and planning. Some folks put in an extra P or two, but given the present company, I've kept to the polite version. And we also know that generally if we put rubbish into something, we're going to get some kind of rubbish out the other end. And it's no different with systematic reviews. And I suppose my first key message is not to underestimate the importance of pre-planning. It needs time, it needs critical thought, and it involves searching the literature. And this is the bit, certainly when I'm supervising students or novice researchers doing their first review, people have a great idea and lots of enthusiasm and want to get on with doing the systematic review. They know they need to write a protocol, so they want to get on with bashing out the protocol, but actually the time spent at the beginning before you even put pen to paper or put fingers to keyboard in thinking about what it is you want to do, why you want to do it, how you're going to do it, and whether in fact it's appropriate to do what you think you want to do is hugely important. And certainly if you speak to experienced reviewers, I think most of them would agree that this is actually a pivotal part of a systematic review. So it's not wasting time, and that's often what the biggest message that I give to my students and to novice reviewers is, don't think of the time at the beginning where you might feel that you're faffing about, for want of a better phrase, or wasting time doing bits of searching and thinking and rethinking and planning. Actually, that's time really well spent. And if you do that at the beginning, you'll do much less of that during the review, and you should have a nice smooth review process. So in terms of the planning, there are really three key things that I'm going to focus on. It's important to bottom out exactly what the review question is. Secondly, important to consider whether a systematic review in fact is needed. And thirdly, is the review that you want to do actually going to be feasible for you to conduct? So I'll just consider these three things in turn. So in terms of the review question, there's lots of reasons for doing a systematic review. Often they may be linked to ongoing research programs where we want to inform grant applications for primary research, perhaps. But often an idea for a review will come from a clinical query. And sometimes reflection on a patient or a group of patients. So a nice example from the literature is around stroke rehabilitation. So somebody working in stroke rehabilitation might observe that there are kind of two key approaches that are taken. There's BOBAth and there's motor learning approach, and might have a question around, well, how do I decide which one I should be using? Is there one that's better than the other, or what circumstances should one be used, etc. So that might spark an interest in a topic, and that person might come along and decide they're going to do a systematic review to try and answer that question. But then it needs to become a specific review question. So rather than that general interest or kind of general question, you need to decide, well, what is it about that I want to look at? Do I want to compare these two interventions and look at some sort of outcome that measures effectiveness? Do I want to look at how acceptable each of these interventions or one or other of these interventions are to patients? Or do I want to look at how feasible they are, or how often they're used in clinical practice? And these would be very different review types and different approaches. And then from that specific review question, you can then go on and start to form your actual PICO question in terms of, so the example of an effectiveness review, thinking about population, intervention, comparator, and outcome, or whatever type of review you're going to conduct. So, and this is really, really important, and it might seem a bit kind of simplistic, I suppose. If, a lot of people say, well, of course I know what my question is. I have this great idea and this is what I want to do. But often this is when it's really worth speaking to people. If you have whether it's an academic supervisor or a colleague or a critical friend, or and actually trying to articulate what it is about the question that you want to answer, because sometimes people find they have a bit of a vague question that's not going to really lend itself well to a systematic review. So this idea, or this question of whether a systematic review is needed, is crucial. We want to avoid wastage in research activity in general. There's no point in repeating something that's already been done. So we need to be sure that our review actually needs to be done and hasn't already been completed, is one aspect. And just to give an example, low back pain, which is one of my fields of research, a very quick search of Medline just in the past year alone identified 333 completed published systematic reviews. That's just in one database. So if I want to propose a new systematic review on an aspect of low back pain, I have to be really sure that it hasn't already been answered in one of these 333 reviews that have been done just in the past year alone. I need to be sure that the question is important as well. So sometimes we might have great ideas for, and not just for systematic reviews, this relates to research, primary research as well, but is it actually going to be of interest to patients, healthcare professionals, or other stakeholders? So we want to be doing systematic reviews to provide informed practice, and for it to be actually useful to practice. So it's worth thinking about that, reading around that, and actually perhaps, again, speaking to people, speaking to peers and critical friends, and finding out whether there really is this going to fill a gap in the literature and in the knowledge base. The other important aspect of this is whether there's actually some published research out there that's going to address the question. So it might be a great question, but if there hasn't been any research done that could answer it, then this is perhaps going to lead to an empty review. And there are different viewpoints in empty reviews. It could be argued that they're not particularly valuable because you can't use them to aid clinical decisions because there's no literature to include. It could be argued that an empty review is quite useful in helping to demonstrate that actually there's no high quality literature out there on this question. So we really do need to go and do some primary research and make some recommendations. But clearly, if you're a student conducting a systematic review for a piece of academic work, then you're not going to be able to demonstrate your skills around data extraction, synthesis, etc. So it's really important to know that there's some literature out there. So a lot of these steps that I've already said around what's the question, do we need to do a systematic review, are going to inevitably involve some literature searching. So some scoping searches of the literature, and that shouldn't be confused with a full-on scoping review, but looking at doing some searches, getting a feel for the literature that's actually out there on the topic. And this is the bit that I often find, again, students and novice researchers find difficult. They think they're doing the systematic review, but they're not. They're doing some searching and getting to know the literature. And yes, when we come to do the actual systematic search during the review process, we shouldn't get too many surprises because we should have a good feel for the evidence base. And then finally, has the question already been answered? Which again, I sort of said we need to know because there's so much research that's going on. So doing really good search for systematic reviews, but also for protocols, so reviews that are already in process, because again, you don't want to be duplicating something that somebody is already doing. However, there is a bit of a qualification. So if you find a review on the question that's already been answered, sometimes it's still worth pursuing. It might be that you can update a systematic review, although you would have to consider whether the group or the authors that published that review would be updating it themselves. You want to consider the quality and whether the question's still current, whether any new methods have been developed since that review was published. So might you be doing something different perhaps within the synthesis? Have new studies been published that you know you're going to be able to include? And finally, would any of these new methods or studies be likely to change the findings or change the credibility of the findings? So sometimes it is appropriate to go ahead with a systematic review if that question has already been answered in certain circumstances. And again, these are all the things that you need to take into consideration in that sort of pre-planning stage, talking to relevant people and getting to know the evidence base. Finally, whether the proposed review is feasible, and I think this is really important thing to consider, and probably not one that certainly I considered when I was new to systematic reviewing, one that is definitely high up on my priority for considering now, having conducted some reviews that turned out to be much larger than we had perhaps expected them to be at the protocol development stage. So it's really carefully considering the time and resources that are available. And this is particularly pertinent if you're conducting a review as part of an academic program. So how long do you have? What resource do you have? And of course, the resource involved in conducting a review is largely human resource. It is time. Also considering what support you have. So a review team or even a student reviewer who has support from their supervisory team and others needs to include topic expertise, methodological expertise, and ideally support from an information scientist or research librarian. Personal experience, I can say that these people are absolutely worth their salt. So if you can find a friendly information scientist or research librarian who has an interest in systematic reviews to support you, you're in a really good place. And we certainly, we're very lucky. We have a research librarian who is very interested in systematic reviewing, helps us with our search construction, and often is a co-applicant on some of our funded systematic reviews and a co-author on our publications. But definitely getting to know where you can source that support, even if you've done quite a lot of literature-based work, the types of searches that you need to do in a systematic review, it's worth having that specific support. And again, there's ways to make a review feasible. So if your question's quite broad, but actually this is a review that you don't have a huge amount of time and resources, maybe it's about doing part of that review, answering one of the questions rather than all of the questions that could be answered, so narrowing it down. If you know there's not a lot of literature on the topic, maybe it is appropriate that the review should be broadened out. And these are all things that need careful consideration before actually going ahead and writing the protocol. And obviously then that leads you to what type of review best suits the review question. As we know, there's many different approaches, different ways, different methodologies for different types of review question. And if you've given really good thought to all the sort of preceding questions, you should have a really good idea of the type of review that needs to be conducted. So we then come to the second part, which is protocol development, but only after you've answered the 3 questions that have come before. So what is the review question? Do I need a review to be able to answer that question? And then, is the review I want to do actually going to be feasible to conduct? So if the answer to these 3 questions is sorted out, then we can come on and think about actually developing the protocol. And I suppose my second take-home message from this presentation would be, it's kind of a repeat of the first one, but it's do not underestimate the time and effort required for good protocol development. This is really your recipe for success. We know that a good protocol prepared beforehand limits bias in reviews. Getting feedback on your protocol, peer review of the protocol is essential. Ideally, protocols are published a priori in order for systematic review work to be transparent, but also to avoid that duplication and wasted effort. And I often think of my protocol, it's like it is my recipe. So if I want to bake a cake that looks great and tastes great, I'll follow a recipe to the letter. And the more detailed the recipe, the better. I'll weigh everything out to each gram, etc. And I should end up with something pretty nice. The only difference with a systematic review, I guess, is you've got to develop the protocol as well. So you've got to, rather than there being a recipe that you can take off the shelf and use, you have to create your own recipe and then follow it to the letter, and then you should get a good outcome. So I'm not about to reteach systematic review methodology, you'll be glad to know. I'm sure everybody listening into this presentation knows that generally systematic review, your protocol will include all these different components because your review needs to follow all these different components. But what I will do is I'll go through each in turn briefly and pick up a few points on each of them that I think are particularly worth thinking about. So we've kind of covered the importance of the question. That's really the first thing you need to do in your planning before you get to the stage of even writing a protocol. And these are just some examples of where you need to go looking to see who else has already answered these questions or may be answering these questions. I'm sure people will be familiar with these. We use OSF, Open Science Framework, generally to register our scoping review protocols. And then, as I said earlier, the clearer, the better the review question, the clearer the inclusion criteria, or the PICO. And as I'm sure most of you know, there are a range of PICOs or variations of PICOs depending on the type of review that you are undertaking. Search strategy. I've already said a little bit about searching, but I think this is really one of the most important things to get right, and important that you get it right at protocol stage. Time invested at the planning and the protocol development stage in getting your search strategy right will really, really make or break your review. Obviously, a good search strategy that is comprehensive enough and that finds the relevant literature is essential, and a poor search strategy really has a huge impact on the validity of a review. So it will take time to get the search strategy right, unless I'm doing something very wrong. And if anybody has a great answer as to how to quickly and easily develop a search strategy, then please enlighten me this evening. But generally, with my experiences, it's a bit of a combination of science and art. You need to do a lot of piloting and testing out and looking at databases and keywords, but it's really worth taking the time to get that search strategy right. And that's why it's important to develop that search strategy and document it in the protocol. Because then when you come to conduct the review, it's actually quite easy. You've done all the hard work, you've done all the planning and all the thinking about different keywords, etc., and how your search is going to be constructed. And all you have to do is go and follow your nice recipe to the letter, and you come up with some nice results. We know that the next stage is study selection, and it's just, we have certainly if we're conducting JBI reviews, we often have some nice set text that gives us a bit of an indication of what should be included in our protocols. And if we look at published protocols, we can see what other people write. But the important thing I find when writing these parts of the protocol is to really think through, well, how am I going to operationalize that? So it's relatively straightforward to know what to write in the protocol, but actually thinking, well, who's going to do that? How exactly are we going to do that? Down to the question of which software are we going to use, when are we going to do it, or, if we've got 2 independent reviewers, which we should have, when are we actually going to be available, how are we going to sort out conflicts, and that type of thing. So it's really thinking about, during the development of the protocol, how are we going to do all these things, because you don't want to come to do the review and then, okay, we've done our we've searched and we've got our literature, okay, how are we going to select them now? So really all these things need to be fleshed out during the development. Same with critical appraisal or methodological quality or risk of bias, as these terms are often used. It's thinking about how, so what tools are going to be used, but importantly, how that's going to affect study inclusion. And I have seen, certainly in the past, I've seen reviews that have been done and people have done a lovely quality assessment or risk of bias assessment on each study, and then they ask the question, okay, so which ones are we going to include? And that's not really the way it needs to be done. So it's thinking at protocol development stage, do you have is your intention to make decisions on including or excluding study based on their quality or based on the risk of bias, or is the intention to include everything and to consider risk of bias when you're reporting the results? So it's really, again, really thinking through how you'll operationalize all the things that you're writing down in your protocol. And the same when it comes to data extraction. Inevitably, data extraction requires some piloting when we get to the actual conducting the review. So, for example, we're conducting a review that's a very large scoping review at the moment, and we prepared a data extraction form, a bespoke data extraction form for this review. It's quite a complex review with a number of items to extract. Prepared it when we were developing the protocol, and that went through a few iterations. We then came to do the review, and we got to version 9 of the data extraction form before we were entirely happy with it. And again, that kind of goes back to that feasibility of doing a review. So we're lucky we have a large review team. This is a funded review, and we had the time. We spent, you know, to get to version 9, I think we spent almost a month of trialing it among different reviewers, and then going back and making amendments, etc. But as far as possible at protocol development stages, it's if you think really clearly about, well, what data do I need to extract to answer my review questions? And again, that seems like such a simple message, but often you do find that there are review questions, and then you go and look at the data extraction form that somebody's proposing to use, and actually it maybe isn't quite going to pull out the data that they need to answer their question. Sometimes we have data extraction bespoke forms embedded into software, for example, you know, the JBI data extraction tools, and that may be fine. That might be absolutely fine for purposes. But if you need something that's bespoke to your review, it's thinking about what exactly do I need, and then some of these other operational things. So who's going to do this? How are we going to do it? Are we doing this using software? Are we doing it using, so some of my students do it using Excel spreadsheets, etc. How are we going to compare data from one extraction if we're having 2 independent people doing it? What are we going to do about conflicts? What are we going to do about missing data? So really, really important to think all these things through, not just to take examples from previous maybe published protocols or examples from what we've been taught, but actually thinking through, okay, I'm saying this, but how am I going to do it? What's my method going to be, and how am I going to operationalize it? Because all of these things, given the appropriate amount of thought and planning, make your review experience much, much more pleasant. And the same can be said of data synthesis. It's about having that clear a priori plan, whether you're going to be doing a meta-analysis or a meta-aggregation if it's a qualitative review, or some sort of data synthesis and integration if it's mixed methods, or a charting in a scoping review. It's quite easy to write these things. I'm going to chart my findings, for example, in a scoping review, but what exactly does that mean? So that we don't get into the stage that we have all our data and then go, okay, so what will we do with it? And then, you know, we could inevitably do lots and lots of different things with it just because the data is there and just because we can, but we need to think upfront, what is it we need to do with the data, and therefore do the appropriate thing and synthesize it and then present it in the appropriate way. And of course, the same goes for reporting, having a clear idea of how you're going to report your data and your findings. So I know that's a whiz through the whole systematic review process. Just to kind of finish on some what are considered some of the common pitfalls, and I can certainly from personal experience say these are definitely some of the common pitfalls I've come across, both myself and among colleagues and people I've supported, and that would be echoed in the literature as well. Not having a protocol or having an unclear protocol is just a recipe for a disaster with a systematic review, because as I said before, your systematic review your protocol is really your recipe for conducting your systematic review. The better that recipe is, the better the review that comes out at the end. And we need to be clear and transparent. And yes, there may be changes that are made when the review is conducted for some very good and valid reasons, and these can be reported appropriately when we're publishing our reviews. But having a clear protocol is the key to having a successful review. The second thing, absolutely, if the search strategy isn't right, then we might as well not bother. We need to be sure, if we're saying we're doing a systematic review, we need to be sure that we are appropriately searching comprehensively, finding all the literature that should be included in that review. Inadequate risk of bias assessment, and also not making the right decisions about what we do with that information. And then again, inappropriate data synthesis. So that might be an example of, say, combining studies in a statistical meta-analysis that shouldn't be combined, maybe due to study type or due to some sort of clinical or statistical heterogeneity. Lots of examples there. But again, if this is all decided in the protocol at the planning stage, what is it we're going to do, then we will do the appropriate synthesis. And how to avoid the pitfalls is, again, it all comes back to the P's. It's about planning, it's about preparation, and it's about having a jolly good protocol to follow. So I hope some of that, I think really most of these messages are very simple. We probably all know that, or have heard them before, have read them somewhere before, in our systematic review training or reading or experience of systematic reviews. But I think sometimes, because often we're in our haste to answer our exciting review questions, it is sometimes easy to forget that actually we need to pull ourselves back and do a bit of thinking and a bit of preparation and give a bit of thought to what it is we actually need to be doing. So I hope if you do that, that you'll end up a bit more like the guy on the right, who has a nice relaxed systematic review experience, although I hope you don't need a first aid kit for conducting a systematic review, and perhaps not so much like the guy on the left. I have a few resources that I've either pulled on for this presentation or that I've mentioned, and of course I will be happy to take questions. Thank you very much.
Thank you very much, Kay, for that excellent presentation and for providing us the practical tips to avoid those pitfalls. And what you've presented is undoubtedly, I guess, the critical first step when you're undertaking a systematic review. Now, we've got a number of questions for you. I'm going to, the first question is about, so part of the planning stage is you have to look for any existing systematic reviews about the topic of your interest to avoid duplication. But we know that there are still reviewers who do not register their protocol or who do not publish their protocol. And what would be your advice for students, for example, who in the middle of their systematic review would then see a systematic review published about their topic? And, if it's the first time for them to do a systematic review, they feel like it's the end of the world for them. What would be some of your advice or tips on how to go about that?
What a great question. And yes, you're absolutely right. And I've been in that situation with student reviewers as well. It's really, really difficult, isn't it? I guess, we can search all the places that we know to search. We can search use our data, the normal databases, the registries like Prospero, etc., Open Science Framework, but yes, sometimes, like you say, they've either not published or registered, or we've somehow missed something and it has been published or registered and we haven't seen it. However, I suppose it depends what stage people are at. So I've certainly, one that I can recall, we had students who had proposed a really nice review on prehabilitation for people who are having hip and knee replacement surgery, and that very thing happened. They found, just before they were kind of finishing their development of the protocol, they found that a review had, in fact, more than one review had been published, but we actually turned that into an umbrella review. We widened the scope and looked at prehabilitation in more general, in musculoskeletal conditions, and found that there were a number of systematic reviews, and they actually turned that into a really nice umbrella review project. So I guess that's one approach. Or it might be that a review's been published, and again, another situation we've been in a few years ago with a student review where her review was published and it was the end of the world. Actually, when we looked at it, we were like, yes, but actually there's some outcomes that are of interest to you because of your particular clinical, maybe specialty or approach or profession that this review hasn't considered. So sometimes it's still appropriate to do that review, but to maybe focus on some different outcomes or focus on a subpopulation perhaps that hasn't been the topic of a previous review. So I guess these are maybe some examples of how it can turn into not being the end of the world.
Okay, yep, thank you very much for that, Kay. We have another question here. So can you give an example of what you actually mean by inadequate risk of bias assessment?
Yeah, so I guess if if people are doing a risk of bias assessment or doing some sort of, whether it's, you know, whether it's using the risk of bias tool or whether it's a methodological assessment or critical appraisal using one of the different tools, I guess if people are not adequately trained or don't have enough expertise or don't, you know, put that critical thought into actually applying the tool well, because it's something that can seem like quite an easy process to do. There's, you know, these tools are tick boxes. We say, you know, was this done? Yes, no, wasn't applicable. Or, you know, was there a risk of bias? Yes, no, you know, and whether it was high or low, etc. And it can, on the face of it, I suppose, seem like a fairly straightforward, simple, quick tick box exercise, but actually that's crucial. That's the point where we're making a really a judgment about the you know, about the reliability and the validity of that piece of work. So it's important that that's undertaken properly, because that can then inform. So if you decide only to have studies that are at very low risk of bias in a meta-analysis, for example, and actually you don't apply it properly and you end up including studies that are actually at high risk of bias, then that's going to give you that's going to affect the, you know, affect the validity of your results.
So it's actually looking at the critical appraisal tool that you're going to use. That's
absolutely, yeah, and not just the tool, but I suppose how you apply the tool, your ability to apply the tool. And obviously, when you're a student starting out or you're a novice reviewer, that's, you know, that's quite challenging, and you get better at that as you with experience. But maybe it's about getting, you know, getting support with that, making sure that somebody looks at the first couple of critical appraisals or risk of bias assessments that you do, so that you're actually applying it appropriately.
Okay, thank you for that. We've got another question here. How can we best balance the added value or lack of comprehensive searches of databases and gray literature sources versus realistic efficacy and resources?
Yeah, difficult question to give a simple, straightforward answer to, I think. And I understand, you know, I understand that question. I can really, in fact, identify with that question. So the added value or lack of with comprehensive search of data, yeah, so you're talking about databases, searching and grey literature sources, etc. So of course, you know, because I talked about feasibility in my presentation as well, and we've got to think about, you know, we will have a finite resource for conducting a systematic review, particularly if it's perhaps a, you know, a student project or a review that's unfunded perhaps, and it's a difficult one to get right. I guess it's the balance between, we need to make sure that we're doing as comprehensive a search as possible, although and that's where I think this relationship with your information scientist or your librarian or a more experienced systematic reviewer comes in, because they are likely to be able to give good advice on, you know, do you need to search each and every database that exists in, you know, say I'm doing a systematic review in some aspect of low back pain. Do I actually need to search all the different databases that exist within health that may have literature on low back pain, or is there actually a lot of duplication within some databases where there's enough duplication that we don't have to search each and every one? Is it that we, you know, are we going to get any added value from doing grey literature searches, etc.? So I would say if it's a, you know, if your purpose is to do a broad review, so you know, good examples I guess are scoping reviews. So we're doing a scoping review just now where we have searched everywhere, including trial registries, and we're looking for things that are in process, etc. The kind of grey literature, unpublished studies. But sometimes in a review, so an effectiveness review, are we going to get any added value from going out with databases where we know we're going to have high quality RCTs published? So it's about really, and that's where you get the trade-off, I suppose. It's about, all comes back to the review question and the objectives. But you know, your search strategy needs to be good enough. It needs to be appropriate to actually find the literature that's going to answer your review question. And I'm not suggesting it's a simple thing to get right.
I guess there's really no strict, answer to that one.
I think searching is sometimes referred to it as a dark art. It's a bit, I think it is a combination of science and art. There's no two ways about it. And I get asked quite a lot. In fact, I was asked yesterday in another seminar situation, how do you get the right search strategy? And I don't know that there ever is one right search strategy. We might all do it slightly differently. I think there's a lot of trial and error involved, and a lot of consultation with people who are perhaps more experienced.
Okay. Thank you very much again, Kay. I know we're drawing close to 9 o'clock. So we'll probably get this to the end of the presentation. And I'd like to thank you once again for accepting our invitation to present tonight. And that was really enjoyable. And I'm sure all of our participants from the night have enjoyed and learned so much from your presentation. Thank you very much again, Kay. And before we end today's session, I would like to hand this over to Alex again for some reminders.
Thank you, Lucy. And thank you, Kay. I can see that we're running out of time, but there's quite a few more questions. So we will get those questions to you, Kay, and get back to you on that. And Lucy, thank you. You are certainly the hostess with the mostest. Next week, we have a former JBI student coming back, Megan Kane, who is currently working as an orthopedic surgery trainee in New South Wales, will be back. And she'll be here to talk to us about applying systematic review evidence to practice. So thank you again for your attendance. I'm sorry we've gone over time. I hope you've enjoyed this evening's presentation. Make sure you register for next week. And until then, stay safe and stay well. Bye for now.